With continued improvements in trends, Ontario will remove the mandatory masking requirement for most settings on March 21st, with the exception of select settings such as public transit, healthcare settings, long-term care homes, and high-risk congregate care settings. Removing the mask mandate does not mean the risk is gone. COVID-19 transmission is still occurring across the province, and masks can help protect you and others from becoming infected with COVID-19. In fact, we can expect indicators such as cases and hospitalizations to increase slightly as Ontario increasingly interacts with one another. However, thanks to our high vaccination rates and natural immunity that is developing, as well as the arrival of other therapeutics and antivirals, Ontario has the tools necessary to manage the impacts of this virus. And we should all be prepared that we may need to resume mask wearing if a new variant of concern emerges, or potentially during the winter months when COVID and other respiratory viruses are likely to circulate again. On Tuesday, March 1st, I revoked the instructions for mandatory COVID-19 vaccination policies for the Ontario Public Service and for post-secondary institutions. A process is now underway to gradually revoke all directives and instructions by the end of April, with a focus on moving away from emergency measures to ongoing operations, moving away from reliance on provincial emergency direction through mandatory requirements, providing consistent guidance both across and within sectors, and ensuring support for the most vulnerable are removed last, and lifting of measures in a coordinated fashion.